After some of the toughest months the NHS has ever experienced, with staff exhausted and expecting to be properly rewarded, the government today offered a much bigger pay rise than they had intended to give health workers. But for Abby Omizori, 3% still doesn't respect her work as a nurse in A&E.
I love my job, I love helping people, I love the knowledge behind it, the skill that we use. But it's just so undervalued and it's so dismissed. At first it was like, yeah, thank the NHS. Now it's like, no, you've done your part, so we forget you.
Announcing the new offer today, the Health Secretary said, "We asked the independent pay review bodies for their recommendations, and I'm pleased to accept them in full, with a 3% pay rise for all staff." It was an improvement on the initial 1% the government insisted was the maximum it could offer, an offer Labour branded as derisory earlier today.
Our NHS staff deserve better than this. They've worked incredibly hard throughout this pandemic. The personal sacrifice is astounding.
Although today's NHS pay offer is 3%, the highest forecast suggests the CPI rate of inflation could reach 3.5% later this year. If so, unions argue, it would mean a real terms pay cut for workers. Nurses' representatives are demanding far more, despite the fact that other public sector workers are facing a pay freeze. They want 12.5% to make up for years of underpayment.
On behalf of the 500,000 nurses that we represent, I'm absolutely gutted for the disdain that has been shown to each and every one of those nurses today.
After months of campaigning, including this petition dropped off at Downing Street yesterday, the government's capitulated, but hasn't said whether it will provide the extra funds to meet this increase.
If the government doesn't fully fund an offer like this, what will have to happen is we'll have to take it out of core NHS budgets, and that will inevitably mean worse care for patients. It will basically mean that the NHS can't treat all of the patients that we would like to at the quality we would like to.
But for nurses like Emily Huntingford, it's more fundamental. The final insult after 18 months on the front line.
I feel so angry, so let down. After the year we've had as a profession, it's completely unacceptable to be offering us such a meagre pay rise.
Like so many in the health service, she's in militant mood. Today's offer may be an improvement, but for them it's too little, too late. Juliet Bremner, News at 10.